so next we're going to talk about clean technique. If you're lucky enough to have a sterile tray in your house, then you should use it. However, not all homes are going to have the sterile trays, so you're going to want to stay as clean as possible. Just using a clean pair of gloves, making sure that you change your gloves every time that they get soiled. You're going to want to put on your gloves, and we're going to talk about suctioning the patient. So, patient's coughing needs to be suctioned. You're going to want to go to your suction catheter. Get your suction catheter. It's going to be hooked up to the suction machine. You're going to go into the trach. And once you start to meet resistance, you don't want to keep pushing through because you can cause trauma to the lungs. So once you start to meet resistance, you're going to put your thumb over the suctioning part, twisting on the way out, and getting all of the secretions. If your patient still has secretions, then you can suction again. So you go in, start to meet resistance, you're going to start to back out, twisting on the way out, suctioning for no longer than 10 to 15 seconds. If your patient starts to become distressed and needs some oxygen, then you want to have your ambu bag ready at the bedside, and you're going to hook it up to the trach, and you're going to want to give them some air, squeezing the bag every 3 seconds. Okay, so that's suctioning. Next, we're going to discuss putting a dressing on the trach. So if the trach site is oozing and has a lot of secretions coming out, then you're going to want to go to your dressings. The best one to use is the pre-slit 4x4 gauze. It's already pre-slit, so you can just tuck it in up under your trach. Go under your trach ties, and then you have your dressing. However, if you don't have the pre-slit gauze, then you're going to want to go to standard 4x4s, and you're going to want to fold them in half and tuck one up under each side of the trach. You don't want to cut a 4x4 in half because you would then have the frayed gauze, and that could potentially cause issues with your patient, or they could aspirate on these frays. So that is doing your dressing on your trach. Next, we're going to talk about full trach replacement. First thing you always want to have at the bedside is a replacement trach of the same size and one of a smaller size. You want to have the smaller size available in case you're unable to get the one of the same size back in. So the other thing that you want to have available is your ambu bag. So once you have all your equipment, then you want to make sure that there's always 2 people present, whether it's another nurse, a family member, a parent, the nursing supervisor, as long as there's 2 people for when you're doing the trach replacement. So one person can take the trach out, and the second person can quickly put it back in. So here we have our second trach ready. We're going to undo the trach ties, and we're going to remove any dressings, and then one person's going to remove the trach, and the second person is going to quickly put it back in. So hopefully it will go smoothly, and the same size will go right back in, and you would reattach your trach ties, and then suction your patient, and all is good. However, problems do happen, and it could be possible that the one of the same size won't go back in, so then you want to go to the smaller size. And hopefully the smaller size will go in if the same size is not going in. Then you want to apply your trach ties and call the doctor immediately and let them know that you did the trach replacement, but you had to downsize to the smaller trach size. So what happens if your smaller size also won't go in? So you're trying to get your smaller one in, it won't go in. What you're going to do is get a dressing, cover the stoma, get your ambu bag with the face mask, cover the patient's nose and mouth, and start bagging, while the second person who's there helping you calls 911. So this concludes our tracheostomy review. Once you're in the office for orientation, we do have special tracheostomy and ventilator paperwork that gets filled out while you're in the home on your case. You also do get orientation in the home. You get a full 8-hour shift, and if you feel that you need more, then we would accommodate and make that happen. So this is just the hands-on review of the tracheostomy, and thanks for listening.